This is Kristen Elliott. Today we'll go over Chapter 5, Preventing Medication Errors for Nursing Pharmacology. An adverse drug event is any undesirable occurrence related to administering or failing to administer a prescribed medication. An adverse drug reaction is an unexpected, unintended, or excessive response to medications given at a therapeutic dose. So this is a drug that you would give at an appropriate dose, and you would have unexpected, unintended, or excessive response. An idiosyncratic reaction is an unpredictable response. A medication error is a compromise of the rights of medication. So if you'll just pause the video and take a moment to write down the 9 rights of medication and refresh yourself. And then an allergic reaction, as we went over last week, is an immune response that occurs to the drug. Common causes of medication errors or adverse drug events include abbreviations, inability to read a prescriber's writing, miscommunication, and confusing drug names. Most errors are due to the breakdown of a system, not due to one individual. Within your system that you work as an RN, the system will hopefully have just culture. This means the punishment should be just or appropriate to encourage the reporting of an error. This means that the culture is not so severe and disciplinary that if you do happen to make a medical error, they occur, you will be able to report it and prioritize patient safety over the fear of losing your job. More than 2 million cases of adverse drug reactions occur annually in the United States. This includes 100,000 deaths. Think about how many that is. You'll see throughout your book boxes that say QSIN. QSIN is an organization devoted to quality and safety in nursing. Now, errors can occur throughout the medication process. So I want you to look, the number 1 area that errors occur are when someone is prescribing the medication. Now, that's not going to be you, maybe someday, but not as a RN. Administering the medication is the number 2 place that errors occur, and that is 100% going to be you. Errors can also occur while transcribing a medication order, dispensing the medication, and monitoring. High alert medications are medications that when you see this ordered, you should stop and think, I'm going to have to spend a lot of time thinking about this. So on page 63, box 5.1, there's a list of high alert medications. So these are any central nervous system drug. These include anticoagulants, chemotherapy drugs, insulin is included on here. These medications can cause a great deal of harm if an error occurs. If I give a patient too much insulin, it's going to be significantly more dangerous than if I give them too much Tylenol. I should give neither. A near miss is when an error happens by chance. An error happens, but it did not hurt the patient nearly by chance. That means the error had all the capacity to harm a patient, but because of some reason, it didn't. these should still be reported. Now I want you to write down what are some examples of the use of technology to prevent medication errors. So how do we use technology to prevent medication errors? If we look in the advantage box here, some advantages of using technology. We can improve accuracy and efficiency. We can safeguard our 9 rights. Our records can be readily accessed. We can also have unit doses, which are prepared daily by the pharmacist, where the computer controls dispensing. Now, some disadvantages here are there's still the human component within the system. A human made the system, and a human is using the system. So error can occur. This system needs to be planned well. So if we look over on the right, that's a picture of a Pyxis. It's a medication dispensing machine. So if I want to get a medication for a patient, I enter the patient's name, I can pull up, say, insulin. So that's great that I do that, but I still have to check the MAR. I have to verify my 9 rights. I have to administer it to the patient, hope there's no distractions, verify allergies, verify the name and date of birth of the patient. There's a lot of steps within there that error can occur. You want to always check your medication before administering. You are going to check the medication record 3 times. All right, now I have a few case studies around here. Our first case study, Mrs. Smith, a 50-year-old woman, originally presented to the hospital with a history of abdominal pain and altered bowel habits. A colonoscopy was scheduled following administration of what was believed to be midazolam 5 milligrams. Midazolam is Versed. It's a benzodiazepine. We use it for procedures such as colonoscopies. She then started to complain of chest tightness, difficulty breathing, and generalized tremors. It was soon discovered that a medication error occurred, and the patient was instead administered 0.25 milligrams of epinephrine instead of midazolam. The procedure was postponed for several days until the patient recovered. So epinephrine was mistakenly placed in the box with the midazolam. The ampules of the medication were similar in size, shape, and color. Following this incident, the hospital instituted a policy to review drug containers and double-check drug delivery. Now, we talked about the just culture, right? This is the non-punitive culture. I want you to take a moment to write down a few ways this is important. So why does a just culture matter? Next, we'll talk about the severity of the medication error. So that number 1 is the just culture. So that would be no error occurred, although circumstances or events occurred that could have led to an error. And as I mentioned before, it's important that these errors or potential errors are documented and given to whatever system you work for, their risk manager. This is because the next time that this situation occurs, someone else may make that error and that may cause patient harm. 2, the type of medication error that causes no harm. So the error was made, but there was no harm. 3, the medication error causes harm. And 4, the medication error results in death. So we can see the severity of those errors. Medication errors overall are considered to be preventable events. This is because we have all of the tools we need to prevent them. There are multiple systems of checks and balances. We need to check the order before giving the drug. We could ensure legible and correct orders. If you're unable to read the order, call for clarification. Use your resources, ask questions. Prefer that you get a drug guide or use an electronic drug guide while you're working. It's preferable to asking a friend. Even if you trust them, the drug guide's going to be more accurate. And then you want to check the medication order 3 times. Very important. You also need to go through your 9 rights of medication administration. Those 9 rights are not meant to be a hassle. They're meant to keep your patient safe. Again, here are our 9 rights. Memorize them. And then reporting medication errors. So the hospital systems are going to have a system through which you can report medication errors, all errors. So when you're reporting a medication error, we'll do it through the system. We also need to notify those who we're working with. But overall, the patient is your #1 priority. This being said, if I give a medication that stops the patient's heart, I'm not going to spend 15 minutes trying to find the charge nurse, the provider, to tell them I made a mistake. I'm going to tend to my patient, administer CPR. We do need to report to the prescriber and nursing management. So a way in this situation that could be done, I would start CPR, hit a code blue button, tell somebody who comes in to notify the prescriber. And then you're going to document the error per policy and procedure of the facility. You're only going to use factual documentation. So you have documentation within the risk management system, and you have documentation within the patient's chart. You need to document in both. In the patient's chart, you are going to document the medication administered, the actual dose, observed changes in the patient's condition, and when the prescriber was notified, and follow-up orders. The nursing student realizes that she has given patient a double dose of an antihypertensive medication. That's a blood pressure medication. The tablet was supposed to be cut in half, but the student forgot and administered the entire tablet. The patient's blood pressure just before the dose was 146/98 milligrams of mercury. What should the student nurse do first? So I want you to look at all the different options and determine which one you think is best. All right. So it's chain of command. So does the nursing student have a license? No. Whose license is the nursing student operating under? The clinical faculty. So notifying the clinical faculty is going to be #1. Now, you may have been tempted to say, take the patient's blood pressure, which is huge, right? If we think of the nursing process, we want to assess first. Now, we know that a lot of oral medications take 30 minutes to take effect, and you already got the blood pressure before the dose. So is the blood pressure going to change in 5 minutes? It's not. We also want to continue to monitor the patient, and it'll be important to notify the patient's physician, but notifying the clinical faculty is going to be #1.